Welcome back. We want you to listen to these statistics. Nationally, about 1 in 5 adults, that's 44 million people, experience mental illness in a given year, and that including more than 7.7 million veterans with PTSD. South Carolina is ranked among the states with the highest prevalence of mental illness and worse access to that care they so desperately need. Here to tell you more about mental health care facility right here in the upstate are Mike Rowley and Marianne Bennett from Havenwood Behavioral Health at Springbrook. Good to see you guys.
Good to see you. Thank you for having us on.
Of course. And it's a very important topic. Mental health is something that a lot of people are talking about right now, and people are coming to the point where they're like, we want to talk about this. We want to talk about our battle with this. Tell us a little bit about what you guys do at your facility.
Well, Havenwood at Springbrook, we're a psychiatric hospital, acute psychiatric care. We offer care to adults and seniors. That could be dealing with an emotional or a psychiatric crisis. They can also be dealing with substance abuse issues. We treat adults all across the age range, including some specialized senior care. We've been up in Travelers Rest for over 35 years. We were one of the first psychiatric hospitals here in the state of South Carolina, independent psychiatric hospitals, I should say. And
when you read those numbers about how many people are dealing with it, and in South Carolina where it ranks, I mean, those are startling numbers. I mean,
pretty staggering numbers.
Yeah.
I mean, 1 in 5 is a lot, and those can range from anywhere between mild depression to someone that might be really having a crisis situation that would need to come in and work more intensely with a psychiatrist and a therapist, and kind of work through those moments to help, I guess, kind of reset. Sometimes life can feel pretty overwhelming.
Right, and it could be something that something you never experienced before, or it could be something that you have like a family history of something like that. A good question would be, how do you know whether maybe it's just something like anxiety or something more serious? And then whose responsibility is it to get that help if you're not able to do it on your own?
So most of what we see is patients in crisis, and I think there's no doubt that you would not recognize a crisis. So whether you're posing a danger to yourself or a danger to someone else, and this is very difficult for patients to deal with and very uncomfortable and families to deal with. So when they either show up in the emergency room or call a mental health facility, then there's a team there that can really work through and support them, whether they're having significant depression or anxiety. They could have PTSD, schizophrenia, where maybe they're losing a little bit of touch with what is real and what is not real, or they have issues with substance abuse. And so they're ready to take that journey to recovery. They're making that decision, or they've relapsed and they want to come back to that decision. And then of course, your loved one who's getting older, geri care. And so what that crisis moment is kind of stabilizing through medication and group therapy and treatment, so that you're more ready for things on an outpatient basis and that you have a plan of where to go from here.
And I think that's the real catch there, is to make sure that there's a plan in place so that you're not adding even more overwhelming decisions to an already overwhelmed situation.
Exactly.
Absolutely.
And I think as you talk about when to get care, it's when the mental health issue, the emotional issue starts to really disrupt your daily life. If you're not able to get up and get to work, if it's disrupting school, if it's disrupting relationships, things that would have always been there and part of what you do, but when those are really key indicators and key things. If you're looking at a loved one and you're watching them, this is when we really need to seek a little more help. And that help can come across a wide range. But when you start to hear people that talk about, maybe it's better that I wasn't here, maybe better that I wasn't, you really need to pay attention. Those are pretty key warning signs.
Yeah, I was going to ask you some of the warning signs, because we all deal with our friends and family members on so many different levels. And we take things in jest many times, but we don't know when something is serious and when it's not. And it's always, I would imagine, to act out of a series of caution rather than saying, because you can't go back and fix it later, right?
Right.
Absolutely.
In many situations.
Right. Absolutely.
So, talking about our veterans too, and PTSD, what would you say to those folks at home that may have, veterans of the military and, not sure exactly how to handle that situation and getting them into care too? I'm sure you guys deal with a lot of cases like that.
Okay. So I think the veteran population is a very difficult population. They're very proud. They have gone through a lot in war or combat or deployments. And so it takes a lot of bravery and a lot of substance to get through that. So what they don't understand sometimes, what relates to PTSD, is you're in a fight-flight mode. That's what your body does when you're in danger or perceived danger. And so that's meant to be a very short-term thing, but in battle or war or deployments, it becomes a very prolonged thing. And it really causes, you know, temporary and permanent physiological and psychological changes. So someone who's been able, you know, tough and handle things all of their life, all of a sudden cannot beat this, and it's very difficult for them to get help, and it's
because
a stigma.
it's a perceived weakness.
Exactly.
For them. Yeah.
But when you look at the statistics, those who get help have a 4.5 suicide rate. Those who don't get help, and those who don't get help, that raises to 38%.
Wow.
So that is so significant. It shows you that you can save lives. And we do treat them very respectfully and understand that. And a lot of things are geared towards, you know, respecting their time in the service and their unique situation.
And I think that's special, and that's very important. And the Havenwood, if they want to get in touch with you, they can go to the website below. Will the first consultation be like just a face-to-face and kind of analyze the situation to see where they are?
Yeah,
Absolutely.
You can come in and we can do a free psychiatric assessment and kind of see where their needs are and what kind of care they need to get. And that may be with us, and it may be somewhere else in the community.
And knowing where the best fit is.
Yep.
Thank you guys so much for all the work
You're welcome.
that you do in our community. We appreciate you. And again, havenwoodbehavioral.com has information on that. We appreciate it.
Thank
Thank you
you.
guys.